Good evening, everyone. I'm Michelle Leifer, the director of the Usedan Institute for Animal Health Education at the Schwarzman Animal Medical Center in New York City. Along with my colleague, Valeria Menendez, I want to thank you for joining us for tonight's webinar, Top 5 Eye Issues Seen at AMC and How to Spot Them Early, with Dr. Alexandra Woerdt. This webinar is for informational and educational purposes only and is not a substitute for professional veterinary advice, diagnosis, or treatment. If you have concerns about your pet's health, we always encourage you to reach out to your veterinarian. Tonight's event is being recorded and we'll send out a link tomorrow in case you'd like to watch it again or share it with a friend. We'll also be taking questions in the chat and we'll leave time at the end to answer as many as we can. Just a quick note about next month's webinar. On Wednesday, November 19th at 6 p.m., we'll be hosting hip dysplasia in pets with Dr. Nathan Scherzan. You can find details and register at amcny.org/events, and we'll also include the link in our newsletter going out tomorrow evening. And now it's my pleasure to introduce tonight's speaker. Dr. Alexandra Woerdt is board certified by both the American and European Colleges of Veterinary Ophthalmologists. She joined the Schwarzman Animal Medical Center in 1994 and leads AMC's ophthalmology service. We're so grateful to have us here with us to lead tonight's event. Please join me in welcoming Dr. Alexandra Woerdt.
Thank you, everybody, for joining tonight. I see a couple familiar names, no doubt. And let me see if I can manage to share my screen. And it's probably this one. Yeah, I think that's the one. So these are the top 5 issues that I see at the AMC and some little hints on how to spot them early. Of course, this is just a very, very brief overview. Each eye issue that I'm going to be discussing, I could use 2 hours to just talk about them. So this is just a very brief overview from these things that we see pretty much every day at the Animal Medical Center. Okay, so first of all, welcome to the ophthalmology service at the Animal Medical Center. I have an amazing team, and those of you who have seen me before will recognize these faces. On the left, I have Mr. Peter Pineda. He's our assistant. He is just, he's got a great sense of humor, and he has got an amazing touch with cats. In the middle is Thomas Hall. He is my technician, and he's been with the service for quite a number of time. He's been in the field of veterinary ophthalmology for more than 20 years, so that's a lot of experience there. And then there's myself, and the true star of the show is my little miniature poodle, Bella. So first of all, a very, very brief anatomy of the eye. This is just very, very brief, where, oh, there's my little cursor. Part of these, of course, are not in this drawing. There will be the eyelids, which would be sitting right here. The conjunctiva, which is basically the pink tissue that lines the eye. And then we go into the cornea, which is right here. We go into the iris, which is right here. We go into the lens, which is sitting right here. And then the fundus, the retina, is in the back here, where you can see all the vessels. What do we see most commonly at the AMC? Of course, we see a lot of things, but the thing that we see a lot of is and I must immediately say that 4 or 5 of them, the initial complaint is frequently redness and discharge. So if we look at these complaints of redness and discharge, what are the most common things associated with those? One of them is keratoconjunctivitis sicca or dry eye. 2 is a corneal ulceration. 3 is glaucoma, high intraocular pressure, and 4 is conjunctivitis, or what is commonly known as a pink eye. And then number 5 does not usually present with redness and discharge, but can have vision implications, and that would be diseases of the lens. Nuclear sclerosis is a totally normal aging change, and then we have true cataract. Nuclear sclerosis right here, cataract right there. So the very first one is keratoconjunctivitis sicca. Now that's a big old name basically saying for dry eye. Now, what is dry eye? In a normal tear film, you have three layers. The very outer layer is the lipid layer, which is produced by little tiny glands in the eyelids. And that is a very important layer because it prevents evaporation of the tears. And then the middle is a very large, basically aqueous, watery layer that has got all sorts of substance in there for nutrition for the cornea. And then on the very bottom is a little mucoid layer that makes it all stick to the cornea so it doesn't immediately roll off the cornea. Now, keratoconjunctivitis sicca or dry eye in dogs is usually a deficiency of the aqueous layer of the tear film, so of the middle layer of the tear film. And what causes keratoconjunctivitis sicca in dogs? The most common reason is an immune-mediated destruction of the tear glands, which basically means their own immune system attacks the tear glands. And because of that, they can no longer produce tears and you get dry eye. That is usually the most common reason for that. And there's no doubt that certain breeds are predisposed to that. The West Highland White Terrier is one of the classic breeds that we see it a lot in. Cocker Spaniel, absolutely. English Bulldog, but the truth about it, I can see it in any dog breed, in any mixed breeds. I can see it in any dog, more commonly as they get older than in very young dogs. And then there's other reasons as well to have keratoconjunctivitis sicca. There are certain medications that can do that, like a very well-known medication that can do that is trimethoprim sulfa, which is a very powerful antibiotic where sometimes we have no choice but to use that based on antibiotic sensitivity. But you have to be very careful, and your veterinarian will probably then also measure tear production, and by any signs of early dry eye, start the discontinue its use because we do not want dry eye. Having a prolapsed gland of the third eyelid, or nicknamed cherry eye, also makes it more likely you're going to get dry eye later in life. Now, if you surgically reduce that gland to where it came from, then the chance is still a little bit increased, but not a whole lot as compared as if there was never a cherry eye. If you actually cut that gland out or leave it at, your chance of getting dry eye later in life all of a sudden goes up a lot. So what are the early signs of that? Now, initially, these signs may be fairly subtle, and it can be discharged, especially in the morning. Now, of course, a lot of us ourselves, we may have a little bit of discharge in the morning, and we kind of just rub it off. It's part of getting your day started. You wash your face and it's gone. And in dogs, sometimes also they kind of wake up. There's a little bit of discharge in the inner corner. It's not a big deal. You grab a Kleenex or like a baby wipe. Oh, you know what can work really well to clean a little bit of discharge? If you get in a nice tub of the unscented baby wipes, make sure they're unscented. And it works really well to use those to clean a little bit of discharge there because it's a nice big tub. You pull one out, they're a little bit moist, and then after use, you just toss it out. So anyway, that's beside the point. So if you see a little bit of discharge, especially in the morning, that may be completely normal. But if it seems like you're getting more and more discharge, or it used to be just once a week and now it's every day, that could be a sign of early dry eye. You may also have an eye that is kind of red, has some discharge. You take it to your veterinarian, they diagnose conjunctivitis and treat it with topical antibiotic, and it gets better. But then after you stop it, the discharge comes back again. That can be a sign of dry eye as well. If it gets more chronic, you have this chronic redness. Sometimes eyes get red if a dog gets really excited. It has a lot of fun being outside, or it just met a new puppy or a new person, gets really excited. The eyes get red. That can be completely normal as long as it subsides again within a couple hours. But if it's like chronic and doesn't go away, that can also be a sign of early dry eye. Now, early dry eye, or any dog with dry eye, they're more likely to develop a corneal ulcer, and corneal ulcers are not nice. We'll get to that. So what are some of the other signs Excuse me for just a second. Okay, what are some of the other signs of more chronic dry eye? In people, dry eye frequently we can manage with just a little bit of an over-the-counter artificial tears. If that's not enough, we can certainly start other medications. But the signs in people, as far as the consequences for the cornea, are much less, thankfully, than they are for the dogs. If you have chronic dry eye in a dog, then what the eye does as a kind of protective mechanism to protect the very sensitive cornea, it starts doing several things. It starts building up a lot of like new vessels in this area. And it's not uncommon that the eye also starts to develop a lot of pigmentation on the surface. Pigmentation is not good because pigmentation is brown and can start interfering with vision. So we do not want that. So chronic dry eye in dogs eventually can be blinding because you can have pretty significant corneal scarring and pigmentation and vessels. So it is definitely something you want to make sure that gets treated. So if you see severe mucoid discharge, meaning every morning these eyes are shut, and you kind of have to gently soak them to get them open, that certainly is a sign, could be a sign of pretty significant dry eye. Chronic redness, and like I said, these corneal changes, the fibrosis, which is scarring, some vessels growing in, corneal pigmentation. Now, how do we diagnose these? We diagnose these by doing a Schirmer tear test. And what that is, it measures the aqueous, so the watery part of the tear film. Normal is greater than 15 millimeter per minute. But these values, they're not absolute. You have to interpret it in light of the clinical findings. There are some animals that have very nice tight eyelids, like some of the little poodles, my own little dog. And they really do not need quite as much tears to keep a very nice, comfortable surface of the eye, the cornea completely clear, no clinical signs whatsoever. Whereas if you've got a bulldog with these big eyelids that a lot of times they don't blink very well, they don't close very well, they need a lot more tears. So in some dogs, a tear production 10 millimeter per minute may be enough and may not be need to be treated. And then there's other dogs where the tear production is 18, which is technically normal, but they have some corneal scarring, they have some chronic discharge, so they need more. So they may need treatment for dry eye. How do we treat it? There's a number of treatments. The picture on the right is currently the only FDA approved treatment for dry eye in dogs. And this is actually an interesting story behind that because the vast majority of time, medications get developed for use in people. And then in the veterinary field, we look at that and we go like, huh, I wonder if that would work in animals as well. And we do studies and evaluate whether or not it works in animals. Well, this was the other way around. Optimmune cyclosporin, which is topical cyclosporin ointment, was first discovered by a veterinarian that it increased tear production in dogs. And then after a number of years, the human pharmaceutical companies caught on and they started developing what is called Restasis. So this was one of those things where we as veterinarians came first and the people followed. So this is the, like I said, this is the only topical FDA approved product called Optimmune. Excuse me. My heater just told me that my office is cold. Anyway, this is a topical encyclosporin ointment. It can work very well in a lot of dogs. In some dogs, it's not quite strong enough. And then we go to what we call compounded medication, which basically means these are not commercially available products. They're not FDA compounded, but they're not produced in an FDA approved facility, but they're specifically made for your dog. And that can be higher concentrations of the cyclosporin, or this could be other medication like tacrolimus. Artificial tears are always good, but artificial tears are never as good as an animal producing their own tears. Because the effect of an artificial tear might last like 10 minutes, 15 minutes maybe, but then it's gone. Whereas if you've got your own tears 24 hours a day, that's much better. But it can help to use some additional over-the-counter artificial tears solutions, or especially if you're going to go away for a while or at night, use some over-the-counter artificial tear ointment. Sometimes we use topical antibiotics because what happens is if you don't have enough tear film flowing, you can get a secondary bacterial overgrowth on the surface of the eye. And the topical antibiotics can be used to treat that. And that's why in early dry eye, if you use a topical antibiotic, frequently the signs get better, but then they come back because if the underlying problem is not addressed, the signs are going to come back. Sometimes we use topical anti-inflammatory medications, such as a Neopolydex or something like that, to help suppress the inflammation that's associated with the dry eye. The whole goal of treatment is dry eye is twofold. One of them is we want to make sure the eyes are comfortable, and two of them, we want to maintain these eyes visual as long as we possibly can. Most important thing about treatment is don't stop. Dry eye is not something we can never cure, which means medications are good. Some sort of medication is going to be lifelong. But what works today may not work 6 months from now. What works 1 year may not work the next year. So it is important to keep monitoring these eyes. If all medications fail, there is a surgery options where we transpose the opening of a salivary gland in the mouth to the eye. Of course, that is not tears, it's saliva. But in some animals in which everything else fails, that can be a good procedure. There are some animals that can be very easily treated. Fortunately, most dogs very easily associate an eye drop with a treat, which is very good. I have some owners tell me that the dogs around the time when they're due for their treat, they start walking towards the bottles where the place where they know the treats are and the bottles are because they know they're gonna get a treat. There's some animals that no matter what do not want to be treated. In those, it is possible to put an implant of cyclosporin under the tissue that lines the eye. It's not something we routinely do, but it's certainly something that can be done, usually under a short anesthetic. Kitty cats. Kitty cats are different in just about anything with eyes. And they're no different from the dry eye. The clinical signs are much more subtle. It's usually a little bit of squinting. They kind of blink the eyes a little bit more than you're used to. A little bit of discharge, a little bit of redness, but not nearly these very dramatic things like you can see in dogs. They don't have all this discharge. They don't have all the corneal changes. And it can be a little bit tough to diagnose. This typical Schirmer tear test, sometimes it can work very well to diagnose dry eye in cats, but a lot of times it doesn't really tell me a whole lot. They fortunately usually do respond very well to just artificial tear supplementation. So what to look for early dry eye? Discharge, especially in the morning. If it's like here and there, once in a while, every once in a while, don't worry about it. If it seems to be recurring every day, that might be more concerning. Persistent redness. It's not just when they're excited or they're outside having a good time, but the eyes are always more red than you're used to. And if you get a topical antibiotic and seems to be getting better, but then once you finish it, the signs return, that could also be a sign of dry eye. So that's a very brief overview of dry eye. Corneal ulcers, a very sleepy looking dog. Okay, corneal anatomy. We come back to this picture again. Oh, there's my browser. There's my cursor, I mean. And little cross section here. We have the corneal epithelium here. Then we have a big, what we call stroma. Then we have a very thin elastic membrane here called Descemet's membrane. And in here, back here is the endothelium. These endothelial cells constantly pump out fluid from the cornea, maintaining the cornea in this clear, transparent state. The cornea is very, very sensitive. As anybody who has ever had anything stuck in your eye, it hurts. So corneal ulcers are typically painful. The cornea, normal cornea, is completely transparent, does not have any vessels whatsoever. And what the cornea does, it actually helps to focus the light onto the retina. We typically think of the lens focusing the light onto the retina, and sure enough, it does that. But actually, what really helps to focus the light onto the retina is the cornea. So what are some of the clinical signs of a corneal ulcer? A corneal ulcer is a break in the corneal epithelium. So the very surface layer is now disrupted, it's no longer intact. Like I said, these dogs or cats, they're painful. These eyes are red, they're keeping the eye closed. So not just redness and discharge, but they're really keeping the eye closed. And when you want to try to look at these eyes, they may shy away from your hands because they go like, oh, don't touch my eyeball. And you may or may not see something like this, where we have a visible lesion. Now, this eyeball, we have put a little bit of topical anesthetic in so that we can evaluate that also a little bit better. That is, by the way, not something we can ever do therapeutically because topical anesthetics delay the healing of a corneal ulcer. So, unfortunately, that's something we can do for diagnostic, but not something for therapeutic. So what kind of corneal ulcers are we talking about? If we have only a break in the most superficial layer in the epithelium, that's a superficial corneal ulcer. Can have many, many, many reasons for it. Once we start going into this, where you see an obvious kind of depression, a crater in the cornea, that means the stroma is involved as well. And that can progress from superficial to the more deeper layers of the stroma, especially if you get a secondary bacterial infection in there. It is usually the initial trauma, especially if you've got a little trauma, the cornea can heal very well from that. Problem starts is when you get a secondary bacterial infection. What we call a desmetacel is all the stroma is basically gone. And now we just have this very, very thin elastic membrane sitting there. It's just very, very fragile. And if it goes beyond that, then we've got a corneal perforation, which is a nice way of saying there's basically a hole in the eye. Now, what causes corneal ulcers? Well, there's many reasons for corneal ulcers. Dry eye, definitely a reason for that. But also look at this little dog. Look at how incredibly open these eyes are. Like this animal, when this little dog, very sweet little dog, when it blinks, it never closes the eyelids fully. So if you look really closely, you can see there's a kind of a whitish haze right there. And it's kind of same thing here. So what is happening is this dog never closes his eyelids fully. So the very center of the cornea is always exposed and is very much prone to any kind of like drying or trauma. So these guys are very prone to getting ulcerations right in the center of the cornea. So exposure is a very, very common reason. Of course, you can have other reasons as well. What we have here is a kitty cat whose lower eyelid was rolling in. So the hairs were directly rubbing against the cornea, and we've got a corneal ulcer right there. This is another example of something. If you look really careful, you can see a little something here. What that is, this is an eyelid that we kind of flipped out. So we kind of turn it outside. So we're looking at the inside of the eyelid. This is an abnormal eyelash called an ectopic cilia that is growing right there. And animals don't really have eyelashes like you and I do. But sometimes we get abnormal eyelashes growing. And the most common one are called distichia, where it's just growing right out of these little glands. These are the little glands that produce the fatty not litter, fatty layer of the tear film. And sometimes you can get little tiny hairs there. They usually don't do anything. But sometimes these hairs grow right on the inside. And just imagine having a hair that every single time this eyelid blinks, it rubs over the cornea. That is going to eventually cause a corneal ulceration, which is very uncomfortable. So that's another reason. Of course, we can have trauma. Yes, absolutely. But a lot of times, corneal ulceration is actually not caused by trauma, but can trauma cause it? Absolutely. Or a foreign body. This poor dog, he had a grass on that was stuck behind that third eyelid, the extra eyelid that dogs and cats have. You and I do not have it, but dogs and cats have it. There was a big grass on stuck there. And every single time this poor animal blinked, it was rubbing right over the surface. And now what frequently becomes the biggest problem, a little something gets in the eye. It happens all the time. Usually the eye will just tear it out and there's no problem. Sometimes it leaves a little tiny scratch. And again, that can heal very quickly, no problem. But you get a real big problem if you get a secondary bacterial or fungal infection right there from the environment. That's when the trouble starts. How do we diagnose corneal ulcers? Well, the key thing to that is called a fluorescein stain. And fluorescein stain is a specific dye that we put on the cornea to see whether the very top layer, the epithelium, is intact. Because it does not stain a normal intact cornea epithelium, which means yes, you put that green stuff on and everything around the eye, as you can tell here, the eyelid, the hairs, everything becomes green, like ready for Halloween. But the eye itself is not green. However, if you've got a corneal ulcer, and there's a break in epithelium, the stain adheres to it. So if you can see this right there, that is a corneal ulcer. And with the cobalt blue light filter, it really shows up as a very, well, I would call it, it's not a nice green spot, as a green spot. We don't like to say it's nice. If we've got a potential that there may be an infection setting in, that doing culture of that ulcer is a good idea. It's not often necessary, but sometimes we do that. So how are we going to treat that? Well, that's a whole 4-hour lecture. And that all depends on the severity of the ulcer. If we've got like the previous slide that I showed, that was a very superficial corneal ulcer. Little dog had had a bath, got a little bit of shampoo in its eye, had a very superficial corneal ulcer. That should heal just fine. So like a topical antibiotic will be sufficient and should heal just fine. The eye that we see here, where we've got a very, very, very deep, severe corneal ulcer. There's a lot of fluid around it. There's some vessels coming here trying to heal it all. This animal is going to need much, much, much more aggressive disease treatments. It also depends on the animal's age. A young animal typically tends to heal a corneal ulcer very quickly, whereas if you have an old animal, they really take their time. So what I would expect to be healed in 3 or 4 days in a young animal, yeah, maybe takes a week or two in an older animal. So if you've got a nice senior citizen that is 16 and he comes to me with a corneal ulcer, I'm probably going to tell you, it's going to take some time. You're going to need to be patient, and that's okay. So what kind of treatments do we typically do? We do topical antibiotics to treat an infection if it's there and to prevent a secondary infection from getting in there. Because remember, the very surface layer is no longer intact, which means that the deeper layers of the cornea are exposed potentially to bacteria from the environment. So you want to make sure you don't get a secondary bacterial infection on top of it. There's many topical antibiotics available that can be either drops or ointments. I don't have a strong preference, drops versus ointments. So frequently I will ask my owners what they think is better, easier for them to administer. Some people prefer drops, some people prefer ointments. Whatever you use, if you're not sure if you got it in or not, if you're not sure if it got on the eye or if it got on the nose, put another drop in. You cannot possibly put too much into an eyeball. So that's just kind of a general rule of thumb. We definitely do want to use more frequent applications if the ulcer is more severe. So if it's a very superficial, uncomplicated corneal ulcer, I might say, okay, let's use it 3 times a day. If we've got a very nasty infected corneal ulcer, I may have you do it every couple hours for the first 24 hours or so. So that's topical antibiotics. If you have a very severe corneal ulcer, then sometimes what can happen, the pupil secondary to that can become very spastic. and that is uncomfortable. So then we may use atropine to dilate that pupil if there's a painful spasm present. If that's not the case, I typically do not use it. Sometimes people refer to that as a pain medication. It's not a pain medication, but it does dilate the pupil if there's a painful spasm. So if that's the case, then yes, it can help with comfort. Pain medication, there are no topical medication that we can use for pain. They just don't exist. So if we use pain medication, it's medication by mouth. And that can be things like non-steroidal anti-inflammatory medications such as carprofen, or it can be something like tramadol, which is a controlled substance to help control the pain. And very important, we want to make sure we treat the underlying disease. This was a poor dog. He came to me, his head was squinting. We saw this cornea also sitting right here. And I lifted that third eyelid back, and guess what? Way deep down, there was a grass on embedded, and it was rubbing over the surface. So the very first thing, of course, we did is take that out, and then after that, it healed just fine. So if a dog comes to me with a corneal ulcer, I always look for a reason for it. Make sure there's not some sort of a foreign body there. Make sure there's not some sort of an ectopic cilia or an abnormal eyelash. Make sure the tear production is okay, so that we remove any kind of reasons for that ulcer to be there. And then we start treating the ulcers. And we can also sometimes use some artificial tears or lubrication just to help with comfort as well. If things get more significant, if there might be what we call melting corneal ulcer, where some of the bacteria, they can produce substances that basically just kind of lyse the corneal tissue and that melt the corneal tissue away. If we see that, we may use your own animal's serum. So we take a little bit of blood from your own dog or from like a happy, you know, just a happy donor dog that wouldn't mind donating like 5 cc of blood to exchange for a lot of cookies, then we can use that as well. It doesn't have to be your own dog. It can be another dog as well. But anyway, we spin that down. We use the serum. What I frequently personally use is a commercially produced amnion drop solution. It's very, very good. But if that's not available, then serum can do a really good job as well. If it's severe, we may also use antibiotics by mouth because some antibiotics are actually secreted in the tear film. So by using the antibiotics by mouth, you kind of get a steady flow of antibiotics over the cornea as well. And then other medications as indicated. If we've got a very deep corneal ulceration or a perforation, we may need surgery. A lot of ulcers can heal on their own with proper medication. Some of them just need surgery. And what I've done here, I've taken a little piece of the conjunctiva, the tissue that lines the eye, and I've sutured it right into this defect. So very, very tiny little sutures. It's the kind of suture that if you don't look at it, if you don't remember where you put it, you can't really find it because it's so small. So anyway, I sutured that in in the place. We let that heal. And then once it's all healed, after a number of weeks to months, we can sometimes, this area will always remain. That is going to be a patch that's always going to remain, but we may be able to remove that stalk. But that can be very effective in getting these very deep ulcers or perforations to heal, thereby saving the eye so that we still have vision in that eye. Sometimes we use sliding grafts or we use other sort of grafting materials. There's multiple different surgery options. That is definitely something that requires specialized training and specialized techniques and equipment to be able to do that. Cats are different again. I guess I said that earlier. Cats are always different. Cats are amazing in what they can heal. Now, having said that, cats also have something that we typically don't see in dogs. They have viral induced corneal ulcerations. Feline herpes virus is one of them, and we will get to that later in this lecture. And the treatment may differ slightly from the dog. They are very sensitive to atropine, meaning if you put a drop of atropine in a dog, supposedly it tastes bitter. I've never tried it, but supposedly it tastes bitter. And if you put a drop on the eye, part of it is actually transported from the eye through the tear drainage system into the nose and in the back of the throat. And supposedly atropine tastes bitter. So if you put that on an eye in a cat, they can sometimes actually like taste it to the point that they're like foaming at the mouth. So you think you poisoned your poor cat. You didn't, but that's a reason why I really don't like using atropine in cats. And some cats also may need antiviral medications. Some cats can also be very sensitive to certain topical medications. So bottom line, what is good for a dog may not be good for a cat, but they are amazing in healing. So what are we looking for? Most importantly is not just the redness, but squinting as well. Brachycephalic dogs, any of the short-nosed dogs, these ulcers can go from being very minor to very severe in a very short amount of time. So potential corneal ulcerations in a brachycephalic dog, do not just give it a couple days, get treatment immediately. On that same note, if you've got a brachycephalic dog, like one in this picture, or like a Frenchie or something like that, something cute, you can never go wrong to use and getting the dog used to use a little bit of an artificial tear ointment or some sort of other viscous lubricating gel like an optics care twice a day in the eyes. Just make it a routine. They get breakfast and dinner and they get lube in the eyes twice a day. You can never go wrong with that. Again, you don't want this to be a struggle, but if you've got a dog who goes like, hey, okay, fine, let me just do this and then give me my breakfast, you can never go wrong with that. Okay, we come to number 3, glaucoma. Glaucoma is not a good thing. Glaucoma is basically a disease of the optic nerve, and it is very different in people than it is in dogs. In dogs, it is very quickly blinding. Sometimes even 12 to 24 hours can completely permanently blind an eye, and it's very, very painful. So what causes glaucoma in dogs? There's 2 big reasons. One is called primary glaucoma and one is called secondary glaucoma. Now, primary glaucoma is where you have a breed-related abnormality in the drainage angle from the eye, which basically means the drainage angle in the eye, that's the angle through which the fluid normally gets drained from the eye, because the eye has a very active turnover of fluid inside. It needs to be, because all the structures like the lens, they all need to get the nourishment. So you need to have a very active fluid circulation to keep everything functioning well. But if you've got a drainage angle that is not quite right, in primary glaucoma, they're born with angles that are not quite right, and they keep deteriorating during life until at some point in time, it just cannot handle the normal outflow pathway and normal normal fluid production anymore. So then you get a buildup of fluid inside the eye, which is glaucoma. And that can go very quickly. An animal and an eye can be normal in the morning and have raging glaucoma by the time you come home from work. And that is present in many breeds, and typically both eyes are affected. Usually one eye develops true glaucoma before the other eye, but typically both eyes are ultimately affected. Secondary glaucoma is secondary to an under eye disease, such as inflammation in the eye, which is anterior uveitis, a shifting lens, or an intraocular tumor. Picture on the right is a Cocker Spaniel that I stole from the internet. I put a link there. And the Cocker Spaniel is definitely one of the predisposed breeds. So what kind of clinical signs are you looking for? Again, this is typically very, very, very acute. So you leave in the morning, your dog is fine. You come home and your dog is not greeting you at the door. You go like, well, that's weird because he's always there to greet me. You find him and he doesn't seem to feel well. You may not even notice that it's his eye that's bothering him, but he's just not feeling well. And then if you happen to look at the eyes, which you probably will, because you're going to look at him because he's not feeling well, you notice this kind of an appearance, a very cloudy eye, which is a whole lot of extra fluid in the cornea, a very dilated pupil. And this eye in the acute phase typically does not have any vision. You may not notice that if it's that's the first eye, because the other eye will compensate beautifully. But you notice a lot of redness, very cloudy, and a very dilated pupil. Now, if glaucoma goes on chronically, eventually the eye can become bigger. This eye was much bigger. This was a little chihuahua. This eye was much bigger than it should be. The cornea eventually typically clears. This is still red. Sometimes the redness is not as much. This is a lens which is kind of shifted out of its normal position. And by this time, this eye is permanently blind. How do we diagnose it? We measure the intraocular pressure. And what you're seeing here is we use a tonal pen to measure the intraocular pressure. Another instrument used is called the tonal vet. Either instrument is fine. Normal is 10 to 20. Now, another thing that I may be able to do is something called corneoscopy, where I can differentiate between is this primary, meaning both eyes are at risk, versus secondary, meaning it's hopefully only this one eye. And this is corneoscopy. Now, for little orientation, this is the iris, this is the pupil, and here is the cornea. So I'm actually looking special lens to look at the drainage angle. This is the drainage angle, and this is what I want to see. Kind of a nice white area, and I see lots of little strands, but a whole lot of openings in between these strands. This is what I want to see. I don't want to see this, where I have the iris, have the cornea, and you see like there's like no space. And I don't see any little strands. I don't see any flow holes. This is what's called corneal dysgenesis. That is primary glaucoma. So how we treat it, acute glaucoma is an emergency. Whatever you had planned for that night is now canceled. You're gonna bring your dog to an emergency room that can handle acute glaucoma. And that's very, very, very important because the permanent loss of vision can occur very quickly. And in an appropriately staffed emergency room, they will use topical medications such as latanoprost. It's called Xalatan. That's the brand name, and or intravenous medication mannitol to lower the pressure as quickly as they can to try to have the best chance of this eye potentially regaining, or if you're looking retaining vision. Again, vision could return or be maintained if there was some vision there, if the glaucoma is caught early. What medication do we use? The most commonly used medications are 2% dorzolamide, which is this one. It comes in an orange cap. 0.5% timolol comes in a yellow cap typically. We do not like to use that in cats that may have asthma because it can really make the asthma much worse. I also don't like using it in especially small dogs with heart disease. I don't like using that. Now, frequently, these two medications are combined in a product that's dorzolamide timolol, brand name Cosapt, and it has a very dark blue cap. So if you've got a very dark blue cap, that's dorzolamide timolol, not just dorzolamide. These other medication, latanoprost is also a very, very commonly used medication. It used to be super expensive, fortunately not anymore. These are other medications that we sometimes use as well. And every animal is a little bit different on what invention they're going to need. Glaucoma. If we catch an eye with acute glaucoma early, we may be able to do surgery to try to give that eye the best possible chance at long-term vision. And typically what we would do in that instance is we would implant a little glaucoma filtering valve right under here, right under the conjunctiva, the tissue that lines the eye. You see a little tube sitting right here in the eye. See this little tube sticking right here. You can't see the valve, but it's sitting right there under the conjunctiva. So what that does, it provides an alternative outflow pathway for that fluid. So we kind of bypass this abnormal angle and drain it right under the conjunctiva. At the same time, or at a different time, we typically do some sort of a laser procedure to try to reduce the production of the aqueous humor. So we have less production and a different outflow pathway. Now, this all sounds very wonderful, and it can be, but it's not for the faint of heart because the eye does not like any of this. It wants to develop inflammation secondary to this, which can plug up the valve. So we may have to inject substances to unplug that valve again. The eye likes to wall off this valve because it says it does not like that valve. It doesn't belong there. I'm going to build a nice capsule around it to wall that off. Well, we don't want that because then the valve can't work. So we may have to go back in. Frequently, this is the best possible chance at long-term vision, but it's very involved. How do we treat corneal glaucoma? In chronic glaucoma, the eyes are blind. So comfort is our goal. So if we can keep the eye comfortable, meaning the pressure normal within normal range with medication, great. If we can no longer do that, then for comfort reason, we typically do some sort of a surgery, which can be removal of the eye, which may sound not a good option. It's actually not bad for a dog at all. They're comfortable. I think they're cute, but I guess I'm a little biased. And what I frequently do also is a procedure that we call chemical ablation, which I can do in most dogs with just a sedation, where I inject a substance in the eye that is basically harmful to the tissues that produce the fluid, and thereby you get less pressure and the glaucoma can resolve. So cats are different again. Of course they're different. They're cats. Clinical signs are much more subtle. The onset is usually much slower rather than the acute onset in dog. And a lot of times this kitty is very extreme in that he's got these big pupils. But a lot of times the first sign of glaucoma I see in cats is that the pupil is just bigger than you're used to. That can sometimes be the only sign of glaucoma initially in cats. So if you've got a kitty cat and you go like, you know what? You're looking at me, and one or both pupils are bigger than I know they used to be. Time to have the pressure check. It might be a normal aging change, but maybe it's not. How do we treat these? We can use topical durzolamide or brinzolamide. Like I said, be careful with the timolol. Latanoprost does not work in cats. And some of the surgical options that we have for visualize in dogs don't work as well in the cats. So treatment is a little bit more challenging. How do we spot it early? The first eye may unfortunately not be diagnosed until blindness has set in. Because, like I said, one of the crucial signs that you may notice is that vision has decreased. But if you have a completely normal other eye, you may not notice. But in breeds that are predisposed to glaucoma, you can do a Google search to see if your breed is predisposed to glaucoma. If you notice persistent redness, but especially this acute onset of cloudiness of the eye, if you notice that, you come home, you see this, all plans are canceled, you and your dog are going to the ER. Of course, if you've got the second eye, immediate decrease in vision, again, your plans are canceled, you're going to the ER. And that leads us to conjunctivitis. You can see why it has a nickname pink eye. It's pink. So conjunctivitis is redness, swelling, discharge, inflammation of the conjunctiva. And as we've seen in the previous slides, redness, swelling, redness, discharge, inflammation of conjunctiva can be associated with a lot of diseases. So the first thing we want to do is rule those diseases out. So we want to make sure we check the tear production. If it's normal or increased, it's not dry eye. We do a fluorescein stain. If there's no stain uptake, it's not a corneal ulcer. We check the intraocular pressure. It's normal. It's not glaucoma. And there's no other causes for the eye to be red, such as inflammation inside the eye. Once we've excluded all those things, then we say this is truly conjunctivitis, which is a disease of the conjunctiva without having any effects on the other parts of the eye. In dogs, the most common reason, allergies. And seasonal is very common. Spring and fall, I see it in here in New York City a lot. Something that we see more commonly in the young dogs is called follicular conjunctivitis. If you look really careful, you see these little tiny follicles here. And they are part of, and you see, of course, they're more prominent there, but they're kind of like everywhere. And those little follicles are part of the immune system. And in some dogs, in young dog, it kind of like overreacts, and you get these little to something, anything in the environment. And you get the formation of these little follicles. And the follicles become irritating again. And then you get a vicious circle because then these follicles are irritating. And more irritation creates more follicles. More follicles creates more irritation. Vicious circle. So that you do have to treat typically with an antibiotic steroid to kind of help calm that down. And that is something that, like I said, is a young dog disease, is pretty rare past the age of 2 or 3 and is really harmless. Bacterial conjunctivitis is pretty uncommon, and viral conjunctivitis is pretty uncommon as well. So the vast majority of them are just allergic. So how do we treat it? If it's very mild, you can certainly try a topical over-the-counter allergy eye drop, such as Pataday or Aloe. I have no commercial interest in either product, but I tend to use these 0.2% Pataday. Sometimes we need topical antibiotics if you get a secondary infection in there. Sometimes we use a little bit stronger than just an over-the-counter. It's in topical anti-inflammatory medications. But one of the key points is a reevaluation is necessary if these signs recur after the medications are finished. So then maybe there was something else and it was not just a conjunctivitis. In cats, it's a different story. They're often infectious in nature, and feline herpes virus is the most common virus for that. Feline calicivirus can also do it, Mycoplasma, Chlamydophila. And the very important thing with this is that treatment typically avoids any kind of anti-inflammatory medications, because in dogs it's totally fine to use anti-inflammatory medications because most of the time this conjunctivitis in dog is not infectious in origin. In cat it's usually infectious. So we typically treat with topical antibiotics such as erythromycin or terramycin, and we may or may not need antiviral medications. So talking about feline herpes virus, it's a very, very common virus in cats. Been estimated at least 90% of all the cats in the United States have the virus in them and go through it during their lifetime as a kitten, usually like this little kitten. It's an upper respiratory infection in young kittens. They get through it. It's kind of self-limiting, like you and I have a cold. And then the virus goes dormant in the body and it can come back when it's stressed. Now, if it's just a mild infection, you might get a little bit of like a pink eye, and sometimes more than just a little bit. It can be quite prominently red, but they can recur, they can heal from that very nicely and really have no signs. But the virus can also sometimes attack the tissues that line the cornea, the epithelium. And then guess what? We get corneal ulcerations. And then guess what? We can get a secondary bacterial infection from the environment, and you can get very significant corneal ulceration that may even lead to perforation. Now, this kitty cat on the bottom had a very significant feline herpes virus infection in the cornea with ulcerations, and the cornea did its best to try to heal that. And it healed that, but partially is like by kind of like growing over the third eyelid and growing it into the cornea in an attempt to heal it. Also, some tissue from the conjunctiva moved over here to heal it. This is all the body's attempt to try to heal it, and frequently, unfortunately, these attempts do not result in an eye that has vision. And especially in these little kittens off the street, this can sometimes be very, very severe. So how do we treat feline herpes virus infection? Stress is a major, major, major thing. So stress reduction is very important. There are some cats where that get recurrent flare-ups, and they always get it when the owner goes away on vacation. That is like guaranteed. If they go away on vacation, cats don't like it if you leave. They really don't like it. They typically, one thing cats really don't like too is moving. If you move and you have a cat that has a history of feline herpes virus, pretty good chance it's going to flare up. But anyway, so stress reduction, try to identify if there's anything that stresses the cat, and if possible to reduce that, that would be great. We use topical antibiotics to prevent secondary infection. We may or may not use topical antiviral medications or antiviral medications by mouth. I personally think that a lysine, L-lysines by mouth does make a difference. The evidence is very controversial. Some people say it has absolutely no effect whatsoever. My philosophy, there's no known side effects to it. You can get it basically in a treat form, so the cat doesn't know it's getting treated. It thinks it gets a treat. And there are some clients that notice a big difference if they, as soon as they stop it, the signs come back. So I have no problems using that. Again, stress, 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 stress. Anything you can do to reduce that would be great. Now, they can recover very nicely. This is a very, very badly affected cat because his immune system was not working well at all. So he got a lot of involvement of skin as well. And here he's healing very nicely. He can see again, his lesions have started. In the end, he looked much better than it, but this is already looking good. And we're gonna finish quickly with lenses. This was one of my cataract surgery patients. What does the lens do? It focuses the light onto the retina. The lens continues to grow during life. It keeps growing. It obviously cannot get any bigger because our eyes do not get any bigger as we age. So the lens grows inside and it kind of gets more and more compact in the lens, in the center, in the nucleus. So then we get the process called nuclear sclerosis. Anybody who's over the age of 40 knows what that means. At some point in time, you need reading glasses, kind of like this. And dogs and cats, of course, don't need reading glasses, not like this little dog, but you can sometimes start to see a little bit of a haze. It happens in any dog over 6 years of age. It happens a little bit later in cats. This was my good old boy Hudson. He passed away about a year and a half ago, but he still lives on in my lectures. Here was snoozing, and here is his eye. You might think this is a cataract. Actually, it's not. He never had a cataract as he lived to be 16. He never had a cataract. This is all nuclear sclerosis, normal aging change. Like I said, it does give a cloudy appearance. And here, this is the whole lens. And this is the nucleus. The center of the lens has become really, 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 really dense. This is a true little tiny cataract. Now, can it affect vision? Yes, because it may affect close-up vision. So if you've got a 14-year-old dog and you notice that your dog is going towards a food bowl, but then uses its nose to really locate the food, that's because things close up get fuzzy. Nothing you need to do about it, nothing you need to worry about it. Now this is different. This is a cataract. This is a true opacity in the lens. This is true cloudiness. If the cataract is small, does not interfere with vision. As the cataracts get bigger, eventually, yes, we can get a blinding problem. Most common reason, something in their genes. Second most common, secondary to diabetes. This little dog had diabetes. And then there's other ocular diseases that can cause cataract as well. Surgery is the only option. There's lots of products on the market, if you Google them, that promise all sorts of wonderful cures. They do not work. There's not a single product that has a single thread of evidence behind it. So what do? We do phagofragmentation with it, if at all possible, artificial lens implantation. It does require general anesthesia in dogs. And prior to surgery, we do two tests. An electroretinogram. This is an electroretinogram to test the retinal function. This is the retina responding very nicely. And an ocular ultrasound, because we do not want to see this. This is a lens, the L. This is a retina. The retina is not supposed to be floating like this. This is a detachment. This is an eye in which I'm not going to be able to do cataract surgery. Thing about cataract surgery, lots of aftercare. There's another Uzden video I did some time ago about cataract surgery that goes in all those details. But this is cataract surgery, where with a little phaco tip, I break up this cataract, and once all the cataract is done, if at all possible, I put an artificial lens back in place again. Little doggy, getting a little bit of oxygen before anesthesia, before surgery, and after surgery. It was adorable. So, how do we spot these things early? Signs to look for: chronic redness, persistent discharge, squinting or pawing at the eye. If you see any kind of visible lesion on the cornea, if you see an asymmetry between the eyes, like a difference in pupil size, or if you see a decrease in vision, those might all be signs that something is going on. And that was the top 5 things that I see. A very, very quick, brief overview of something that could be a 5-hour lecture.
Mhm.
I'd be happy to answer question. Let me stop sharing and
I can
open the chat.
I can read you some, and then first of all, that was fantastic, and thank you. I know there's a lot to go through, but we have 3, other previous lectures or webinars by Dr. Woerdt, which we will send you links to tomorrow, all excellent, which go into a lot of this in more detail, but you did a fantastic job going through it. Thank you. Okay, we have some questions, and let's see. So any tips on the best way to remove discharge from the eye that has hardened in the fur by the eye?
Okay, any tips on removing that? First of all, you want to make sure there's not like underlying dry eye there. But if there's not, there's some animals, especially these dogs that have these very, very what we call tight medial canals, where the inner corner is kind of turned under and they have chronic tearing. That can sometimes lead to kind of like crusted discharge. What can work really well is go to any drugstore and buy a travel size baby shampoo and dilute 1 part of baby shampoo with 20 parts of tap water and use that on like a cotton ball to like that way you can really like gently but you can kind of scrub that area, soak it, scrub it and get it off, and you don't really need to worry about getting it in the eyes because it's just baby shampoo.
Okay, great, great. Can a dog develop eye allergies later in life?
Yes.
Okay, great. And how can you tell if a dog has a scratch on the eye? Scratch on
um
the cornea.
the one is scratch on the eye, that's corneal ulcer. So
Cornea.
the most important thing you will notice that the eye seems to be uncomfortable, persistent redness and uncomfortable.
Okay. What about small growths around the eyelid of a dog? My vet said they can stay because they are not scratching the cornea.
The vast majority of eyelid tumors in dogs are actually benign, meaning they're not the kind of growth that spread to the rest of the body. If they get bigger, if they start growing towards the eye, then they can start irritating the eye. It's actually not that common. The vast majority of them are pretty smooth. And I frequently say, if your dog goes under anesthesia for something else, like he needs his teeth cleaned, make sure they get taken off at the same time. If
Okay.
they get to the point where they start bothering the eye or they get more significant in size, then it may be best to surgically remove them.
Okay, great. Let's see. We have, this is a good question. Do you need your veterinarian's referral to go to see you?
Oh,
Or can people can
no,
make an appointment directly?
that's right.
And we'll send that information tomorrow too. Let's see. E- Okay, we have a question about uveitis. I guess you treated their Welshie for it and is asking you to talk a little bit about that.
Wait, what was it?
Uveitis,
Uveitis.
uveitis.
Uveitis is inflammation of the iris, and that can have. Was it a dog or a cat? I didn't
I think it
catch.
was Rue. I think you treated there. And was it a dog?
Well,
Believe it
let's
was a
talk about
dog.
both.
Okay.
Uveitis, inflammation of the
Welshie.
iris.
Yeah.
If it's a dog, and well, both dog and cats, you always have to make sure it's not related to something else going on in the body. There are certain infectious diseases in cats, like feline leukemia or FIP or cryptococcosis, something like that, that can cause secondary inflammation of the iris. Same holds true for dogs. In the dog, the list of potential diseases that can do it is much longer than in cats. So what's very important if you've got inflammation of uveitis in a dog or a cat, what is very important is a good physical examination and appropriate blood work to make sure there's not something underlying it. And then the treatment for that is typically anti-inflammatory medications,
Okay.
either topical and or by mouth.
Okay, great. Is there benefit or recommendation to have older dogs have a preventative checkup with a veterinary ophthalmologist starting around 7 or 8?
You can never go wrong with that. I don't think it's absolutely necessary, actually. I think if you monitor for some of these signs that I mentioned here, and you potentially present a doctor and ophthalmologist, if you see any or all of them, I think you're doing a good thing.
Okay, great. Let's see, mycelium terrier has lashes under the eyelid that cause irritation,
Mhm.
can or should the extra lashes be removed?
If the eyelashes, they're probably talking about what I talked about earlier, either the stichiae, which come out at the eyelid margin, or ectopic cilia, which break through and directly poke at the eye. Ectopic cilia need to be removed. End of story. That's it. There's no other thing about it. The stichiae becomes a little bit more variable, a little bit more gray. Because if it's just a few of them and they're very soft and they don't irritate the eyes, you don't need to do anything about them. If there are more of them, especially for instance the bulldogs, they sometimes have these really long, stiff, I call them daggers, where every single time these poor animals blink, it kind of grinds over the cornea. They should be treated.
Okay, great. Okay, although acute, is there any way to detect glaucoma in cats and dogs other than visual changes once it's advanced? She said, I've had dog and cat with glaucoma. Dog needed enucleation. Cat had lens that floated into the anterior chamber.
Um, I'm sorry, I have to see.
So,
Boy, there's a lot of questions.
there's a lot of questions. Yeah. And also, like, Zoom is grouping them in a funny way, so it makes it a little
All
bit
right.
difficult.
Can you repeat the first question, the first part of the question again?
Okay, let me find to see. Basically, that I guess, is there any way to detect glaucoma earlier on?
Yeah,
Mhm.
glaucoma in cats, like I said, the clinical signs can be subtle because it's usually just like a dilated pupil. That's really the first sign usually in cats. In dogs, it is usually the vast majority of dogs is a little bit easier to detect because the vast majority of dogs, not all dogs, Shar-Peis, Chows, Shih Tzus, they sometimes have a more slow onset. But anytime you kind of notice persistent redness and especially like cloudiness, or if you start noticing like a change in the size of the eyeball, then that certainly warrant evaluation. But in the acute cases, especially like this cloudy appearance of the eye, persistent,
Okay.
like the eye is all of a sudden really red, and then if you notice cloudiness as well, yeah, that's pretty classic for glaucoma.
Okay, great. Do all dogs lose vision after cataract surgery? No,
Not
or after proliferation of cells on the posterior capsule. All dogs
oh
lose. Okay.
Okay, that is cataract surgery in dogs. What we do is we basically, what a cataract is the lens is a capsule with contents. And the cataract is basically contents. Think of a normal lens content as a raw egg white. It's transparent. Think of a cataract as a cooked egg white. You can't see through that. So a cataract is where you have a lens capsule and then the inside is completely cooked. It's completely non-transparent. So what you do in cataract surgery is you make an opening in the front of the lens capsule. Then you basically remove everything that's inside that lens. You remove all of it. So you clean it out. And then if at all possible, you put an artificial lens back in place again. Every dog develops some degree of scarring of the lens capsule afterwards. That's a given. Dogs do that much more so than in people. In people, they would laser that off. Dogs, you can't laser that off. People have tried, doesn't work. In some dogs, the scarring is very, very, very minimal. In other dogs, the scarring is more. Eventually, some of them scar so much that they fall in the category 10% category of failure, which is basically they lose their vision again because there's so much scarring.
Okay. Okay. I was fortunate to actually watch you do cataract surgery, which was a procedure which was amazing to watch. We have a video about that as well, which we'll send, so everyone can see that. But yeah, it's amazing work. Let's see. Since glaucoma is sneaky, should there be an annual eye pressure exam as part of an annual exam?
I don't think so. And the reason for that being is that the pressure can be normal today and glaucoma tomorrow. So the only time when I think that actually can be a good thing, if you've got a dog that you know has dysgonial dysgenesis, where they have the abnormal angles, and especially if one eye already had glaucoma, then we typically do monitor the pressure like every 3 months or so. Knowing that sometimes there are some animals where the pressure goes like this: normal, 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 boom, glaucoma. Well, those you don't help by pressure check every 3 months. But there's also some that go like normal, normal, slide, 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 rise in
Mm.
pressure. And those you can really help by a pressure check every 3 months or so. But I don't think that, personally don't think that you cannot go wrong checking the pressure, but I don't think it's necessarily indicated to be part of like a normal exam for every animal.
Okay, great. Are there dietary enhancements to aid in the prevention of dry eye?
Not that I'm aware of.
Okay, okay. Many people saying what a wonderful presentation and that you've treated their pets. We will pass all these along to you afterwards. Let me see if there are any ingrown eyelashes in dogs. I think we
Mhm.
kind of talked about that. Would they need to be surgically removed? Would that prevent them from growing back?
Well, that's what I talked about
Yeah,
earlier.
earlier.
If you have the ectopic cilia, they need to be coming out. The distichia, sometimes they need to be removed, sometimes they don't. Can they potentially grow back? Yes. But a lot of times, not all of them grow back, and they grow back much softer. So some of them may grow back, but no longer be a problem. So you don't have to repeat the procedure.
Okay. Do punctate cataracts become cataracts? I think we have some veterinarians.
Punctate cataract
Yeah.
is basically the smallest. Cataracts is several stages. Punctate meaning is it's a dot. You take a pen and you put a dot down. That's a punctate cataract. Incipient cataract is a little bit more. Like I can fairly easily see it with my equipment. You probably wouldn't be able to see it. And then mature cataract means that eye is blind. Immature is everything between incipient and between mature. So it's a very wide range. Punctate, can they become complete cataract? Yes, but they never may. And truth about it, any dog over 10 years of age, I can find a little cataract somewhere. So I can find little punctate cataract somewhere in every dog past 10 years of age, pretty much. So yeah, the punctate cataract at that point in time means absolutely nothing. And there's a very good chance it will never mean absolutely nothing. It will never mean anything.
Okay. Here's one. I don't any insight on vision problems with a parrot?
That I've seen a number of pairs throughout the years. They do sometimes get cataracts, actually.
They do. Okay. Okay.
Yeah, they typically present through our exotic service. But yeah, I've seen a number for the exotic service over the years with cataract.
Okay. All right. Let's see. Do you recommend OcuGlow or another supplement
I
for
think
overall eye health?
OcuGlow, as far as I know, is the only supplement that actually has some research behind it as far as potentially slowing down degenerative eye diseases. As far as I know, there's no known side effects to it. So would I, if you, there are certain degenerative eye diseases such as retinal degeneration, there really is no cure for it. So would I use OcuGlow if my dog had it? Absolutely, because as long as she would actually eat it without having to pill her. But if she would like the taste and she would eat it freely, there's no known side effects to it. And could it potentially help? Yeah, maybe.
Okay. All right. Wonderful presentation. I know we're a bit over now, so I think we're going to wrap up. Thank you, everyone, so much for joining us. And thank you, Dr. Vanderwerth. This was fantastic.
You're very
And again,
welcome.
we will send everyone the link to this recording tomorrow, as well as the ones to Dr. Vanderwerth's past presentations. And just a quick word about our next webinar is Wednesday, November 19th at 6 p.m., featuring Dr. Scherzan discussing hip dysplasia in pets. And we'll have that information in our newsletter or at amcny.org/events. And thank you all again so much for joining us. And we'll see you at our next event. Dr. Vanderwert, have a wonderful evening and thank you
All
again.
right,
All right,
too.
take care,
You're
everyone. Good night.
very welcome. Thank you,
Okay.
everybody, for joining.